so what I'd like for you to do is just to scale down on ah. Okay, from that from the low B flat. Okay, okay, just on ah. Lovely. All right. It's really, really smooth. Doesn't it sound very smooth? Okay. Now notice, guys, here we're just looking, this is the spectrogram over here, that there's a little change here, and then that was his long sustained note. But there's a little change towards the end. And let's see if we can find it. So here he's just singing, and what we're looking at is this audio signal. You're not seeing that little gap thing happening. Let's see if we can find where that starts to, we start to get a little bit of a gap where things kind of start to die out. Yep, that's like the low D, and that's the C, and there's the B flat. And you can see that it, you know, he kind of runs out of, he has like a ripple, and then it's kind of petering out, and then we get a new one. Okay. So we're going to say, let's go to comparison. We're going to save that. We're going to save that up in here. Okay. So now, can you do that, the low B flat, and then drop completely into just like fly? Which is way, way, way cool. Okay, so here's he's singing, and you can see that it's kind of dying out, right? Okay, and then he went all the way into fry, and you can see where it pretty much completely dies out before the next one. Well, it's way cool because, you know, that's what we hear when we start to hear those individual little pulses, is that it's actually having time to kind of die out. Between your vocal folds are vibrating so slowly, there's enough time in between each impulse that it basically decays enough. Just like if you hear it, ripple, 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 and then it kind of goes away. There's enough time between that you hear the little gap. Okay, that's really what we're seeing. Can I save this for future classes because it's a really great example.
Go for it.
Okay, lovely. Thank you, sir. So now just perceptually, if you can stay one more second, okay, let's see if we can pick out where is it exactly that you start to hear a little subtle change in the sound. I'm sorry. Okay, let's try it again. Like the last three notes, probably. Okay, could you just do really slowly the last three, okay? I mean, it gets down to the point where you can start hearing this, you know, which is, I mean, that's our ears starting to hear, okay, it's sort of kind of petering out in between each one before the next one kicks in. So that's a register transition where you get from, it's a really, really low bass note, you know, like a low chest voice note, to where he's in essentially fry mode, but it's regular enough. You know, those pulses are dying out enough to where we start to hear it. And, you know, someday when you're really, really sick, you know, or like first thing in the morning, and just see how, have you ever seen how far down you can go?
Freshman year of college, I woke up barely able to talk, and I had the E flat, but it was a lip buzz.
Wow. I'm pretty stoked because yesterday, Saturday, I had like a G flat. I mean, I never have a G flat. Okay, thank you so much.
My pleasure.
And it sounds beautiful, you know. And the great thing is with his voice type, you know, if you're singing Zoroastro, or you're singing Baronox in Rosencavalier, or you're singing Spado Fucile in Rigoletto, or a couple of those really low bass rolls, where being able to get down to low C and so on, and it having enough sound to carry really well comes in really handy. And I mean, that's like money notes, you know, for the bass. The bass is one of the few notes in contralto that having low notes and high notes, not just high notes, is where you really make your monies. Okay. Good. Thank you.
Yeah.
Woo-hoo. So yeah, you can see there's the complete fry up at the top, and then here is this singing fry. That's a really great example. So, coolio. Did you guys have a good weekend?
Yeah.
All right, I'm going to save these 2 files so that we can use them again. Where should we put this? Let's put this. This PC. Desktop. What shall we call that? Alejandro. Alejandro 1. I didn't spell it right, but that's okay. It's only for me.
Alejandro.
Alejandro, where the wind comes. Okay. Yeah, I'm just saving it so that, because it's always good to have good examples. Somewhere on my computer, I have Rafael Moras doing an absolutely exquisite diminuendo. If I can find it, I'll show it to you guys sometime.
He's doing a Messiah in town.
Yes,
right?
he is. He's in town right now. If you've never heard him sing, you need to go hear him sing. That is a really beautiful tenor voice.
Yeah.
That's a really beautiful tenor voice.
Where's he doing it? He's doing it with the symphony. They're doing it at St. Timothy's.
Yeah.
No, St.
Do you know when?
Yeah, the December. They start December 2nd, and they go for 2 weeks.
Yeah, he's a very, very wonderful, sweet guy. And then, of course,
No, they start on the 25th of this.
and he's, well, let's see, he finished up here. He went to Rice, he got his master's at Rice. He's sung in Aspen, what, 2 or 3 summers? And he's been at the Los Angeles Opera as kind of a resident young artist for the past 2 or 3 years. Handpicked by Placido Domingo for that. Domingo's had his eye on him for years and has kind of been mentoring him and helping him, advising him some.
He also finaled in the Met competition like a year, 2 years ago.
Yeah, he was in the finals. He wasn't one of the winners.
Yeah.
In fact, he was a semifinalist as an undergraduate.
Yeah.
Yeah. So, needless to say, a very fine singer. So, if you get a chance to go hear him, please do. Okay, just wanted to go over a few things with our schedule. So today, because we're off the schedule that I had in our syllabus, since we're taking Wednesday off and we took the Wednesday off of Nats, we're about 2 days off. So we're going to do health and hygiene things today. And then Monday after Thanksgiving, we'll come back and we'll do more of that and talk a little bit about hearing health. And then Wednesday the 30th, which, by the way, is my 25th wedding anniversary. Aww, let's do that again. 1, 2, 3.
Aww.
Yeah. 25 years.
Yeah, doing anything special?
Amazing. We're going to London over Christmas break.
That is so fun. Are you gonna bring your son?
Yeah.
Oh, that's
Yeah.
wonderful.
So on Wednesday the 30th, no, it's wonderful. We're all looking forward to it.
Yeah.
Wednesday the 30th, we're going to talk about vocal development over the whole lifespan. Your last 2 observations and your last homework are due that day. And speaking of which, the homeworks, the observations,
Mm-hmm.
you have the final.
Not everyone's. I have
Some of them did, some of us turned it in early.
Yes, I know. I've got those of you who turned them in early, and thank you.
I did mine early.
So your last two observations and your last homework are due that Wednesday, the 30th.
Does that include extra credit?
That includes extra credit, yep. Because I gotta get everything graded. Okay, then Monday, the 5th of December, we'll continue doing the vocal development lifespan stuff. Wednesday, the 7th, will be a review. And then if you want to come on Friday of Dead Day at 11 o'clock, and there's no, there won't be a final because it's a dead day. Come in here, we'll have a review, okay? I know you're not supposed to, but I want to give you guys something.
So do we have 2 more weeks of class?
We have this week, short, then we have a full week, and then we have a short week.
Okay.
Yeah. And then the exam, just a reminder, is on Thursday, the 15th at 9:45.
Thank you.
And it will be short answer and multiple choice, because I have to get it graded by the next day so that I may board a plane to go to London with my beloved wife and son on Saturday. So it will be more questions, but it will be multiple choice and short answer, like fill in the blanks kind of things. So it will be primarily the stuff since the last test. There'll be a few reminders of things from the past. Okay? So, final is Thursday the 15th at 9:45. So that gets us to today, talking about overwhelm. Now, some of you have probably seen, so the handouts that went out earlier were things that I meant to give you last week. And in my adult brain, I just didn't get around to handing them out. So, those are following up more on voice classification kinds of things. I think I've killed a forest by the time the end of this semester goes around. So let's get this one going around, which probably looks familiar to some of you, because I think we handed it out during the freshman seminar thing a couple of years ago, but it bears repeating now since we know so much more. And our brains are so full of all sorts of wonderful things. And you've had a couple more years of experience with your voices. I'm handing back the things that were turned in early. Yay. So those are going around. So first of all, your role as a voice teacher in the health of your students. What is your role? Because you're on the front line, right? Lead by example. Good.
Talk to them about it.
Talk to them about it. Good.
How much practice, how much.
Those are all good.
Supposed to be like a mom.
Sorry?
To be intuitive, they're not always gonna come right out and say.
That's true. They're not always going to come out and say something's going on.
To be gentle about it too.
What else? Something over here.
Gotta be like a mama.
The mama, yeah.
The mama.
You're the mama bear. You're the vocal mama bear, And so, I did a little survey. We did when I was working in Denver for the National Center for Voice and Speech, we had voice workshops, and we'd have 150 people come to these voice workshops.
Wow.
And we surveyed the people who came, and it was a bunch of vocal health kind of questions. And the last question was, who do you go to, who's the first person you go to ask a question about your voice and its health? And we gave them a whole bunch of choices. Well, doctor was number 1, choral director was number 2. Voice teacher was like number 4. Can you believe that? I mean, it was really, I think 3 was like a family member, and then 4 was voice teacher. Yeah, surprisingly.
Wow.
Yeah, I'd have to look back at the results, but I remember choral director was number 2. Probably because more people are in choirs than are in individual lessons. But suffice it to say, I mean, a lot of you guys, you know, music ed and so on, you're gonna be that choral director. Or, if you're the voice teacher, you're the vocal expert in that person's life. They're the one, they're gonna come to you and say, hey, I've been noticing, yeah, I love the hands there, that was good. I've been noticing, they're gonna come to you. And so, it's important to understand what your role is and where the line is, because you're not a physician, you're not a speech pathologist, neither am I. You know, having some awareness and knowledge of warning signs is important, okay? Knowing who to refer people to for help is important. Knowing when to say, this is beyond my knowledge, but I know someone who can help you with this. And it might be that, you know, say you're a choir director and you've got voice teachers who are teaching there in the school. Hey, can you come listen to so-and-so? Or you can ask them, how's it been going in their lessons? They came up to me in choir today. Have they been saying anything about their voice, you know, in their lessons with you? And just colleague to colleague talk a little bit, you know, and that with the student's permission, it's like, would you mind if I talk to, you know, Miss So-and-so who is your voice teacher, you know, just kind of talk about what she's been hearing, you know, okay? But then, beyond that, you know, it's not your job to diagnose. It's your job to say, okay, let me give you some information. You can take this home to your parents, you know, just that I'm a little concerned about what you're reporting about your voice or what your voice teacher's been saying, you know, has been going on in your lessons. So we want to just make sure you're okay. And then you have to not go past your boundaries, okay? Now we have a wonderful situation here where we can send you right over to, you know, a laryngologist, and you guys can get an appointment pretty quickly. And we have a great relationship with the laryngology team, Dr. Simpson and Dr. Dominguez, and both speech pathologists. And, you know, also Jennifer Bergeron, who's another laryngologist here in town. I mean, we have a lot of laryngologists actually available. So we have a great situation here. You may be in a city where that isn't the case. And so one of your jobs, if you move to a new town, is to find out who those people are for your own health, right? You know, because you're going to be singing, you're going to be conducting, you're going to be a church musician, whatever, or performing. And so you need, for your own safety, to know, well, okay, who are the people I can turn to? Ideally, somewhere nearby, there is one of these. Laryngologist. Okay? So we can do a little Venn diagram, okay? All right? So all laryngologists are ENTs, but only some ENTs are laryngologists. Does that make it clear?
Yeah.
So laryngology is a branch of naso, you know, what's auto is ears, rhino is your nose, and so otorhinolaryngology. It's a specialization within the ear, nose, and throat profession. Okay, so you want to see one of these kind of people. If there isn't one, but there is an ENT who has a speech pathologist who works with them, and a lot of them would, who specializes in voice. Now you might be thinking, voice? Well, don't they all specialize in voice? And the answer is no. Some of them, their specialization is like working with elderly people who have problems with swallowing and so on. Or they might work in a school setting where a lot of their issues are dealing with kids who have articulation problems with language, okay? So you want a speech pathologist whose specialization is in voice. Okay, so here at the Health Sciences Center, both Jill and Janelle specialize in voice. They are speech pathologists, and their specialization is voice. So they deal with people who have neurologic problems that affect their voice. They work with singers, they work with lawyers and school teachers, people who use their voice in their job. So you want to be seen by, you know, if you're going for therapy, that's the kind of person you want to work with. Because your problems, I'm imagining, are going to be voice related rather than swallowing or articulation. If you have swallowing or articulation issues, you probably have other medical issues going on anyway that are going to preclude you be doing a lot of singing and so on. So you want to ideally be seeing or being able to steer people towards a laryngologist who has a speech pathologist on their team that works with voice. That's your voice care team you want to seek out. Questions about that? If you don't have, you know, if it is just an ENT, but they do have, that's the next best thing, is the ENT who has the speech pathologist who has a voice specialization. Because they can certainly look at you, diagnose, you know, and therapy and so on, but they would probably saying, okay, there's a voice issue here, they would want to refer you, that's the standard of care, is to refer you to the specialist. Just like, you know, my regular internal medicine guy that I go to for a checkup, if he sees something on my heart, who's he going to refer me to? A cardiologist. If he suspects something's going on and I might have an ulcer or something, he's going to refer me to a GI specialist, you know, and so on. So if they suspect you have a voice pathology, boom, they're going to say, okay, you need to go see Blake Simpson, or you need to go see, you know, Laura Dominguez, or you need to go see Jennifer Bergeron, or you need to go see Rob Eller out at BAMC, or you need to go to Austin and see this person, okay? So that's your big role then as the singing teacher. If somebody has a concern and you're going, yeah, I've heard them and they're not usually breathy and they don't normally fatigue like that and so on, I'm concerned, you know, I want to get them checked out. This is who you're going to steer them towards, okay? So then your job is to know who that person is and to be able to say, you know, if you're concerned at all, let's go take care of this. Let's go see this person. All right, let's look at these things. The old do and don't list. How many water bottles in the room? 1, 2, 3, 4, 5, 6, 7, 8. Are you the black sheep?
I forgot when I left this morning. I was running late because I didn't want to get out of bed this morning because I don't feel good, obviously, but I'm here, so.
Oh.
I know.
But your water bottles.
I was sad. I realized I was halfway here and I kicked myself, and I was just like,
It's okay, I've had those days all the time.
it happens.
Okay, well, get yourself a water bottle out of one of the machines,
Yeah, I
or
will.
visit the water fountain regularly. Okay, stepping back because I'm hearing your sniffle. Okay, so you want to drink regularly throughout the day, especially in rehearsals. When's the time to drink? When is the time that's going to make a difference?
The morning.
Get up in the morning and make sure you get yourself rehydrated, because what's the first thing we all do? We get up in the morning and we go potty, right? Okay, you know, because you've been in the bed 6, 7, 8 hours, right? Wishfully thinking, and your body has been, you know, your kidneys are continuing to work, and so you're a little low at that point. And no matter if you run a vaporizer in your room and stuff, you're still going to get, your kidneys are going to keep working. So you need to get rehydrated early in the morning, especially if you're singing early in the day. Now, there's been some research that showed you could get some change. I remember reading a paper, and it was about 75 minutes from ingesting, you know, like a liter of water to where they started seeing some change. laryngally, but I've also had some other discussions with Kitty Verdolini, who is probably the queen of research on hydration. She's saying 8 hours to rehydrate your vocal folds from having been dry. I notice, because I always work out in the morning, I'll drink a water bottle as I'm like driving to the track to run, or if I've got my bike and I'm riding on my bike, I'm drinking probably a liter as I ride. Or if I go to swim in the pool, I take my water bottle, and in between, breaks of, my workout or something, I'm drinking, hydrating, keeping myself hydrated. Then I'll eat breakfast, and then in school or at home, before I go to sing, I'll probably drink another water bottle before I start trying to sing, just to get myself as hydrated as I can. So think about, your hydration is like driving your car when you're a quart low. The lubrication is really important, especially when you've got tissue that's vibrating at hundreds and hundreds of times a second and so on. Yes, it is thinning your mucus so that you don't feel like, okay, I need to call for clear, but it's also the hydration of the vocal fold tissue itself, that lamina propria, that outer layer, okay? Because if you're dehydrated, the viscosity of that outer fluidy kind of layer then it's not as supple, okay? So it's going to take more breath pressure to initiate phonation, which is not a good thing. We don't want to be working harder than we need to. So, keeping yourself hydrated then is going to keep that outer layer of your vocal fold supple, which then lowers the pressure you need to sing. You're going to be better able to sing softly, especially when you're more hydrated. I mean, there's been a lot of research on that. To sing pianissimo, what they've done is they test what's called the phonation threshold pressure. It's the minimum pressure that you can still initiate a sound at, and it drops the more you're hydrated. Okay? So, stay hydrated. Maintain a regular exercise program. Switch to the other handout. He said with a dramatic flourish. So we have a whole bunch of lovely things. The physically fit singer. Okay, so most important is getting that aerobic exercise, because singing's a very aerobic thing, right? What do we use? Our lungs, yeah? Our ability to sustain a long phrase. If our aerobic capacity is elevated, because when we're breathing for singing, if you remember from early on in the semester, we're having to not only have the breath to sing the phrase, but your body still needs oxygen. Your brain's still saying, I need air. Your heart still is needing oxygen. Your kidneys, your liver, every part of your body needs oxygen while you sing. So if you can make that system more efficient, your oxygen distribution, system more efficient through aerobic exercise, then you're probably going to be able to sing longer phrases. What blows my mind is that people who are highly, highly efficient as singers, in spite of the fact that they may not be in the greatest of shape. I mean, Montserrat Caballé was not in great shape, but she could sing phrases for days. So it's not, cut and dried. If you're not in shape, you can't sing long phrases. But you could sing, imagine what she could have done if she had, been in better shape. So, things to do. The aerobic exercises listed there. Swimming, running, aerobics, rollerblading, biking. I mean, I can rattle off the number of our faculty. So I run, Sherry Rubens runs and swims and teaches aerobics. She does triathlons too. Dr. Wigman bikes. A lot of people walk, an elliptical trainer and things like that. I know Mrs. Petschke goes to the gym a couple times a week, early in the morning. So even just getting out and take a 20 or 30-minute walk 4 times a week, that's going to be great. You'll feel better on campus, going up and down all the stairs and stuff. Aerobic exercises are great for weight maintenance. I mean, my gosh, I love to eat. it's a good thing I love to work out because I would really put on the weight otherwise. Strength and flexibility things, you know, yoga and Pilates and some lightweight training. I mean, I do some weight training, fitness bands and like 10-pound dumbbells and things like that. Feldenkrais is another movement thing. Well, what kinds of movements might you do? Yes, ma'am.
I thought Feldenkrais and Alexander were kind of in the same school. What is the difference between
That's a really good, I think I gave you guys an article by Patty Peterson about looking at the two of those.
Okay.
The big way I kind of distinguish between the two. All right, so Feld and Alexander. Alexander is about changing your thinking in how you think about your body and movement. So it's kind of an inside-out thing. And Feldenkrais, you go through guided series of movements which heighten your awareness of your body as you move, which then changes how you think about your body. So it's more of an outside-in kind of thing. I think both approaches are very valid, and honestly, Feldenkrais studied with Alexander's brother, I believe. I don't think he studied with AT. I think he studied with AR. He didn't study AT. FM. He studied with AR, Albert. So, yeah, they're both really, really good. You know, Dalcroze Eurythmics is a lot of fun and some good exercise too. If you've ever done one of Dr. Frega's sessions, I mean, you're moving around a lot. And it's got the music element to it as well. Things to do. So say you're in the gym and you know you see people doing all this stuff. I think for singers, if you're going to be doing weight stuff, do lots of reps and low weight. You know, so I'll have a low weight and I might do 20 curls instead of trying to do, you know, 5 really straining. I'll do, you know, 20 with a weight I can manage very comfortably. Then my muscles still look good when I go to the beach, you know, and yet I'm not getting over bulky or losing any flexibility. Okay, so lighter weights, more reps. And in terms of some of the static kinds of things, you see people doing, you know, crunches and things like that. Crunches, again, are real good for making your six-pack look good, you know, when you got that sexy bikini at the beach. But, again, that muscle's job is to flex your spine like that. So it's going to pull down on your rib cage, which we don't want for our breathing for singing. We don't want to sag. So what to do for your abs, you know, do the things that are turning kind of movements where you're using more of your obliques. If you want to do some planks and things like that, that's fine. Just have to remember to breathe while you're doing it. Don't sit there and hold. And you know, you can do the plank this way, you can do the planks this way, you know, you can do the planks this way. There's all of those kind of things. Some of the things that work you bilaterally are really, really good too. For instance, well, it's like the hunting dog, you know, things like this where you alternate sides, and so it's my right arm and my left leg, and you can hold it out there for a while. Then you're working bilaterally, so you're getting, again, those obliques going. Or you can do the Superman, which is base plant, where you go this way. Okay? That's harder than the one when you're on your knees. Yeah, doing the Superman, yeah, doing 10 of those, that's enough for the whole day. It's like, okay, yeah, I'm feeling, at least for doing those kinds of things. I mean, but it really is, they're great for if you're into swing dance, if you're into any of those kind of things where you're moving a lot. They're real great strength and balance things, and they're great for swimmers too. That's why I do. You know, you can get some of those fitness bands, and you attach it around like a doorknob or whatever, and you can do arm swings, and you're pulling. You turn this way. You can do some of these kind of things. So that kind of movement with kind of low resistance really really good for singers. You just don't want to be doing that Valsalva thing where you're holding there. And it's important, ideally, you know, that you do some strength, some flexibility, and some aerobic stuff every week so that you get that balance. Okie dokie. So back to this one. Take care of your teeth and gums. Why? Why would I want to take care of my teeth and gums? Who needs them?
I mean, if you're like monies and singing, people have to see your mouth open.
That's true.
Be smelly and
So,
gossipy.
yeah, definitely the cosmetic part of it, right? You know, you definitely want it to look appealing.
But also if it hurts, you wanna sing.
Yeah, if it's not comfortable, you're like, oh, I really can't open my mouth much today. And if your teeth and gums are not healthy, that's one of our first lines of defense for protecting yourself against infection or getting infections. You know, when you go to the dentist, they're looking at your gums. They're looking at the health of your gums in particular. That's one of the first places where cardiovascular disease shows up. Actually, is, you know, like gingivitis is actually been linked some with increased risk of inflammation body-wide, especially in your blood vessels, which is a precursor to heart disease. So any way that you can reduce inflammation and the risk of infection, it's worth it. And so, you know, yeah, you have to floss too. Yeah, I don't like to do it either, but yeah, it's good for you, you know, it's good for your gums, keeping your teeth clean. So that's a really good one because it looks pretty, it smells better, and it's good for your overall health. Eat a balanced diet. Hopefully that all makes sense. Adequate sleep each night. Well, we've all talked about sleep in here already, but I've been through my journey. I know you've talked about you have some struggles with it. Several of us do, you know. You probably, during your lifespan, will have problems sleeping due to anxiety or another medical condition, or you'll have a child who keeps you up all night. For me, it's been anxiety, you know, and I've learned some strategies, especially in the last year or so, of what do I need to do so that I can relax more. And by all means, if you've done all the behavioral things like no computer at night, no stimulating foods, regular exercise, so on, all the behavioral things that you can do, and you're still having trouble, that's when you start talking to your doctor about, okay, what medications can I take? Nowadays, they are not wanting to give the Ambien and things like that, because those are, I mean, I've been on Ambien, Lunesta, Rosarum, I've been on all of those, and they're not nice drugs. They are very powerful drugs. Those are controlled substances. You do bizarre things. You can read in the paper about people who've gotten in their car, like Councilman Wolf, who got in his car and was in the drive-thru in his underwear at Whataburger at like 3 in the morning. Not making it up, it was in the paper.
You don't need Ambien to do that.
Well, that's true. Or people who've been on Ambien and things, and they've gotten in their car and they've had a car accident and they've killed someone. I mean, there was a big case here in San Antonio a couple of years ago. So they're dangerous drugs, and most doctors nowadays are like, whoa, we don't want to have you do that. You can buy melatonin over the counter. It's not controlled at this point. And it's the hormone that your brain actually produces to help you, you know, sleep, okay? So that's something, and that's where you consult with the doctor on in terms of how much you take and so on. I'm freely admit I am using melatonin right now. There are some other medications that doctors sometimes recommend for people. Sometimes a little anti-anxiety medication, a very, very low dose is helpful. There's a medication that I'm on actually right now called trazodone, which they developed it as an antidepressant, and it stank as an antidepressant. But they found it really made people drowsy. If you take it and then you have a little nibble of something to eat, About an hour later, you're like, yeah, oh, I think I'm gonna go to bed now. And it helps you stay asleep. And you taking that in combination with, say, the melatonin helps you sleep better. But sleep is so important. As singers, it's so important to get that restorative sleep. It's good for your memory. It's good for your whole body. Your body needs sleep. If you don't get enough sleep and you're stressed and so on, your adrenal glands start pumping out cortisol, which makes you want to eat more and put on fat. It also tends to increase your inflammation in your body, particularly in your blood vessels, which is not healthy for your body at all. So getting sleep, believe me, if you can prioritize anything about your health, I would put sleep as number one, because you're going to be less likely to get sick when your body's rested. You're going to perform better at things that you want to do that matter to you, like singing. You're going to be less likely to have car accidents. I mean, people who are sleep deprived have car accidents. I saw one time a test, it was on Mythbusters, and they had people who, they were testing them drinking on a course, and they had the police there and so on, versus being sleep deprived. Being sleep deprived was worse than them having had a drink. So, and there have been other studies along the same lines. So, don't deprive yourself of the sleep. Speak with good habits, makes good sense, attend to your whole body, warm up carefully, and warm down. Okay, you guys have a choir performance tonight, yes? Okay, how many of you warmed down yesterday after the choir performance at 3 o'clock? Goose egg! Okay, well. How? Well, those simple things that you do when you're starting, like and sirens and sighs, and maybe your lip bubbles or things like that. Okay, those are all real good things to kind of bring your voice back down. Okay, so yeah, but you're using it gently, and you don't do it for very long. You might take 5 minutes to warm down. So if you ended, you know, like, my gosh, Beethoven 9, poor sopranos in the Beethoven 9, you know, or the very Requiem, you know, where you've been wailing away. Okay, you get in the car, and you know, okay, you're stuck in traffic, you're at a red light. Hey, I've got a minute or two here, and you bubble a little bit, walking to your car. You do humming and chewing and sirens and things like that, to just kind of get your muscles, just like if you went to the gym and you've been on the elliptical or the treadmill or the bike or whatever, you'd probably walk around a little bit to cool off, right? And if you've ever taken an aerobics class or a dance class, they build in a little cool down time. And if you've played sports and you had a good coach, they probably did some warm down kind of things, or stretching or something at the end of practice, okay? So it's the same principle. Boy. Because you want to just facilitate all the blood stuff that's been in the muscles working, that you're getting the lactic acid and so on out of those working muscles. Okay, the backside is a bunch of don'ts. Don't speak, yell over loud noise. Don't smoke, don't smoke. Don't overdo with the alcohol. I think I've told many of you of wrecking my dad's car at age 19.
What?
Yeah, totaled it.
Mr. Nix, were you wild in your youth?
I had 7 beers that night.
And then thought it was okay to get in the car.
7 beers,
Well, then,
yeah. Now, spread out.
the education for drinking and driving wasn't as big as
Well,
Yeah, it was.
Wrong.
And I was dumb, and I fell asleep, and I went off the road and went, and I panicked. And then I was in the grassy median heading towards traffic. Cut the wheel again. Wham! Into a guardrail which protected me from going into a bridge support. Totaled my dad's car. The car engine is going, whee! I'm like, can I move? Okay. Get out. I ran, you know, like 50 feet away. Okay, the car's not going to blow up. And the amazing thing was, somebody just drove right by. They didn't even stop.
Wow.
The next car that came by stopped. It was a friend of my brother's. He's like, Don't drink and drive. Yeah, please.
Yeah.
There's nothing worse than having to call your father and tell him that you wrecked his car. There is nothing worse. Trust it from me. There's nothing worse than saying, I wrecked your car and I've been drinking.
Did you get a DWI?
No.
No?
No.
I would say what would have
How,
been,
yeah.
because what you said earlier about the knowledge was false, but people, it used to not, drinking and driving wasn't cracked down on as strongly as it is now.
Yeah. I should have been. The cop wrote it up as a suspicious vehicle. I got a warning and he wrote it up as a suspicious vehicle.
Your dad forgave you.
Well, we have a good relationship. So, chewing gum, and then I know you guys don't have choir, do you?
We
No,
don't.
we do. No, we do.
You're
Yeah.
kidding me.
For a short period.
Okay, well, chewing gum, we'll end it on this one, okay? Chewing gum. Now, cows were made, and other herbivores, to chew all day. We, however, were not, okay? So, those very muscles that you want to free up to open your mouth to sing that glorious high note, you don't want to spend all day strengthening that muscle, right? Okay? So, trying to get off the chewing gum thing. Now, if you have bad reflux, Jill Green has told me this, if you have bad reflux, chewing a little gum so that you salivate and swallow is probably better than nothing, honestly. But in general, let's not chew all day. I enjoy a nice stick of gum. I'm a sucker for that Lifesavers gum that came out some years ago. You know, of course, the flavor only lasts about 5 minutes, and I'm like, but seriously, don't do it all day long. A little goes a long ways. Okay, so on Monday after Thanksgiving, we will continue doing some health things. I'm going to throw some scenarios at you guys. Okay, like a student comes to you and here's their complaints. So, if you could read up, make sure you've done some of the reading, okay, so that you can have some responses that make sense. So that you've read some of the symptoms of these things, you know, read the McCoy, and I have some things, some PowerPoints and things online, okay, that are kind of like little quiz things that you could go through, okay? I hope you have a wonderful Thanksgiving. If I don't see you, enjoy your turkey, or whatever your family does. Yes, and then the warmed over leftovers, which are sometimes better. I mean, you know, the sandwiches with the turkey or the ham. And I'm a sucker for dressing. Man, the dressing.
What is your thought process? Because I use Sequel a lot to help me sleep if I need it.
Oh, yeah, I mean, that's...
I started using it because I realized when I was sick one time that
It's got-
NyQuil knocked me out.
yeah, it's,
and so I just-
what is it, diphenhydramine in there?
Yeah.
I mean, that's what's in just about all of the over-the-counter sleep medications, Sonomax and all those things, diphenhydramine. It's okay.
Surprised
I mean,
how powerful oils can be. Like just lavender on my pillow.
yes,
Will usually do it for me.
some people,
But it's,
yeah,
it's
lavender
stuff a
really
lot,
works
so I
for
don't
people.
smell it.
Yeah, yeah, I've heard of lavender being, I had a
Or
student,
frankincense is also very soothing.
yeah, there's a couple of those essential oils that really work for a lot of people. Those things tend to be drying though.
Yeah.
That's the big thing with the ZQL. The melatonin is not gonna dehydrate you, and it's actually, rather than making you drowsy, it's literally helping your brain have enough of the sleep hormone that you stay asleep. Now, again, that's something, talk to a doctor.
Yeah.
But, I mean, you can buy it
Right.
without a prescription at, you know, generally, I mean, they sell it in like 3 milligram, 5 milligram, and like 10 milligram. 5 milligrams is considered a half dose. 10 milligrams is a full dose. I take 5 milligrams, I take the trazodone, I take Lexapro, 5 milligrams of Lexapro. It's like 50 milligrams of trazodone, 5 milligrams of Lexapro, and a 5 milligram of the melatonin.
Mm-hmm. You're out.
Sleep really, really nicely.
That's good.
Now, I've done a lot of behavioral stuff too. And
Right,
stick
right.
to that.
I'm trying to work on that because my biggest one is my phone is my alarm often, and I also use my phone to track my sleep at night. But that means
You're looking at that screen.
It's right there, so it's like, oh, well, I'll check my email real fast before I go to bed, or what, you know. And so I've been working on that a lot. TV works really well for me, but I always like dim it a lot, so I have that
Yes.
sound, but it's very low and it's a murmur. It's almost like not really a white noise, but kind of. And so that works for me if I can put the phone down and say, all right, I want a little entertainment before I go to sleep, because I'm bad at just falling asleep. Like, I can't just 9 times out of 10 if I lay down and just close my eyes.
Well, you're still
so,
stimulated. Reading is really good for most people.
Mhm.
Reading, or, you know, some people like to knit, you know, a quiet thing that you're not electrically plugged in a more dimly lit room is really, really good, and removing stimulation, and going to bed at the same time and getting up at the same time.
Yeah,
really critical.
that's a struggle for
Well,
me right now.
that
Yeah.
is absolutely critical, that your body stays on a schedule.
Mm-hmm.
Because I always struggle at the beginning of the school year, because in the summer I stay up
It's
till
like-
11:30, you know. But during the school year, and my son's on the swim team, I gotta go to bed at 9:30.
Yeah.
So marching my body clock back 2 hours, that is not easy.
Yeah.
Now, once you're out teaching school,
Oh yeah. No, when I'm doing my observations, I'm always like, okay, I have to be up really early in the morning, so let's go to bed at 9.
yeah, and the more you can stay, even on weekends and holidays, stay on your schedule.
Mm-hmm. Thank you.
Good luck with that.